Hello and welcome to this week's instalment of Brisbane Health. Most of us know someone who has been affected by heart disease. It's not always the man with the fondness for junk food. Cardiovascular disease can affect men and women of all ages. In today's show, we're going to look at some of the ways that we can prevent heart disease in the first place. We'll also look at what to do in an emergency situation when you think you or someone around you may be having a heart attack. We'll also look at the great work being done by the Heart Foundation. Our first guest today is Rachelle Foreman, the Health Director from the Heart Foundation. So Rachelle, thank you for being here first off. Is it a big problem in Australia, heart disease?
Well, sadly, heart disease is Australia's #1 killer. And surprisingly, I think people wouldn't expect that it kills equal number of both men and women.
Oh, that's quite surprising. So what can people do to reduce the risk?
Well, I guess that we've got risk factors that people can't control. So if they have a family history, for example, they can't control that. And they can't also change their age, because as you age, your risk increases significantly. But then there's a lot of risk factors that we can control. So the lifestyle ones are smoking, physical inactivity, poor diet, or particularly high in saturated fat, salt, those sort of things, and then also being overweight and obese. So they're the lifestyle ones, and then there's some clinical ones which people are even less aware of. That's your blood cholesterol, your blood pressure, and diabetes is a risk as well. So knowing of all of those things, you can look at your mental checklist in your head and go, well, am I healthy on these things? Do I know my blood pressure? Do I know my cholesterol? And then you can sort of look at that. And then if people actually want to have a clinical prediction of their risk of heart disease, they can actually go to their doctor and ask for a heart health check where they look at all of those in their totality and can tell someone an estimate of their risk of a heart attack in the next 5 years. Importantly though, as I mentioned before, age is a risk factor, so we really only recommend that for people who are either over 45 or people who have a strong family history as well.
Well, can I ask, Rachelle, how important is exercise in health disease prevention?
Yeah, well, it's really important actually. It's almost like a wonder drug. It's that good for you. It not only can help prevent nearly all of the chronic diseases that we hear about, but it also is excellent for your mental health. It's great to do socially. It can help people, get out and about in their community. So it's incredibly important. It also maintains bone health. So I guess the important thing around it though is that people don't have to be busting a gut, as it were, to actually get the benefit. We now know that moderate intensity or just a little bit of huff and puff is enough, and 30 minutes a day, and you can break that 30 minutes down into 3 10-minute lots. So if you walk to the bus or the train and back, or park your car further away, it actually adds up.
So making those simple changes can really help in the long run.
Oh, huge. And we also know, though, that sitting less is really important too now with new research emerging. So even if you're active for that 30 minutes or more a day, you also should get up and stand regularly just to sort of get your system moving and not be a couch potato.
And so along with the exercise always comes diet.
Yep.
I think that people should know, what a balanced diet is, but give us a rundown.
Well, I think the problem is there's so much that people hear in the media about diets that they really get confused. But the basics haven't changed over time. So the new dietary guidelines just came out from the Australian government, and they still very much say similar things. The mainstay of a plate should really be consisting of vegetables or carbohydrates such as pasta or rice. Usually whole meal varieties or whole grain varieties of those is better. And then some lean meat. No, it doesn't have to be the big Fred Flintstone steak. It should be about the size of the palm of your hand and the thickness of it. So not a huge piece of protein. And there's things called treat foods or occasional foods. They're not totally off the list, but they should be only consumed in moderation, sort of once or twice a week and small portions. And I guess that's the other thing. If people are thinking about portions, we don't need these mega plates for people to have that food on. If people are trying to reduce their weight, using a smaller plate is usually the best way to start, because they can actually, they think their plate's full and they think they've had enough.
Does it worry you, when I go to a restaurant, I see a big plate there and lots of food, and sometimes I can't even get through it. Does it worry you seeing that sort of thing, knowing what you do?
It really worries me, because people think that's good value for money, and that's not just in a restaurant, that's fast food as well. You want to upsize that. People think, for $1 I can get all that much more calories and fat and salt, is really how I think of it. But they're thinking it's much better value for their hip pocket, but it's not better value for their health.
That's right. So what sort of people should be going and getting checks?
Well, as I mentioned earlier, people who are over 45 is who we would mainly recommend go to their doctor and have a heart health check. But really, anyone over the age of 20 can start to be, having regular checks with their doctor and just know your blood pressure. Talk to your family about your family history. Those tests at the doctor are fairly painless. The only one that's painful as such is that you just need a blood test to have your cholesterol levels done. And your blood sugars as well, so and sometimes a urine test. So they're not painful per se, but often you'll have to go somewhere else to have those tests and then go back for the results.
It's funny that when I think of a heart attack, I always think of sort of an overweight man with a red face, clutching his chest, but other people get heart attacks, thinner people as well, who may not...
Well, absolutely. I mean, as I mentioned before, it's not any one risk factor. Unfortunately, the media focuses a lot on weight, but weight is only one independent risk factor. So physical activity levels and diet are independent of weight. So if someone tries to change those and for some reason they're not losing weight on the scales, but they're healthier, they'll still have improved health. So it's not just the size. You can't look at someone and say, well, they're a heart attack waiting to happen just on their size, because they might have an excellent risk factor profile otherwise. Similarly, just because someone's skinny, they might just be genetically blessed. It doesn't mean they can eat what they want and just sit around and do nothing and throw caution to the wind. They actually, all of those things have multiple benefits, not just reducing your risk of heart disease, but they make you feel better, sleep better, make you mentally better, and work ready, etc. So there's multiple reasons why people should be fit and active and eating well.
That's right. So at the Heart Foundation, you guys working in there and knowing all the background that you do, are you guys quite healthy eaters?
Yes, actually the Heart Foundation staff do very much practice what they preach. We have the occasional treat food, but really people bring in, you look in the fridge, it's salads, it's lean meats, it's carbohydrates and the multigrain bread, the wholemeal bread, etc. Yogurts, low-fat dairy. We do practice what we preach.
And so I'm actually a bit of a sweet treat person. I've got a sweet tooth. How often can I have, indulge in a piece of cake, big piece of cake?
No more than once a week, really. I mean, these, the sweet treats is your thing. What we're actually seeing is a change of pattern in the way people are eating more generally. People are eating out, away from the home, about 4 times a week on average. Obviously, some people are having more than the average and some people are having less. Most of those meals are lunch and dinner. And so what we want people to, we want restaurants and fast food outlets to be more transparent about what's in the food, because people don't really know, and they are eating out more often. So if they're having takeaways, no more than once a week in terms of something that's definitely on the negative. Not all takeaways are unhealthy, such as Subway and those sort of things can have vegetables, but they also can be unhealthy if people add on, extra cheese and mayonnaise and things. They're not, just because they've got a bit of lettuce on them doesn't also make them healthy. So, people need to really look at what they're eating and make those decisions. Because I guess the message we would have is those small changes you make every day add up to make a big difference. Australians are putting on about half a kilo each and every year though. So over 5 and 10 years, that's where the 5 to 10 kilos are coming from. Those decisions every day will help to change
a difference.
That. Yep.
For more information on preventing heart disease, please visit our blog through the 31 Digital website or the Heart Foundation website at www.heartfoundation.org.au. After the break, we'll be talking about the steps to take in an emergency when you or someone around you might be having a heart attack.